Hello guys, this is Dr. Possibility from Excel Academy. Kindly make sure that you subscribe to our YouTube channel and make sure that you register with Excel Academy. In this tutorial, I'm just going to do my part 4 of Anatomy MCQ revision. Let's quickly look at some few questions. The first question is, the anatomist who published the famous and influential book titled De Humani Corporis Fabrica Libri Septem is dash. A. We have Aristotle. B. We have Hippocrates of Kos. C. We have Adrius Vesalius. D. We have Claudius Galen. So the answer here is just C, which is Adrius Vesalius. The book in question 1 above was published in which year? So we have A 1443, B 1543, C 1643, D 1743. The answer is just 1543. The following is best stained with hematoxylin. A. DNA, B. Hemoglobin, C. Collagen, D. Ribosomes. So if you look at hematoxylin, it is just a basic dye, and it being a basic dye, it needs to stain an acidic component of a cell, of which the answer here is just DNA, which is acidic. All are basic dye except A, we have orangey, B, we have toluidine blue, C, we have hematoxylin, D, we have methylene blue. So the answer here is just orangey, which is acidic. All are basic dyes except, so this is just the same question and the answer is just orangey. The following dye constitute the Giemsa stain. A, hematoxylin and leucine, B, methylene blue and leucine, C, Gaussian blue and azubi, D, acid fascicin and azubi. The answer here is just methylene blue and leucine. Glycogen is best stained by A, Mason trichrome stain, B, periodic acid Schiff stain, C, Mallory Hazan stain, D, osmium tetroxide stain. So the answer here is just PAS. The next question is, which staining technique stains the lipid in myelin sheath of nerves black? So we are looking at the lipid component of the nerve, and the answer here is just the oxamic acid. Smooth muscles can be differentiated from collagen by the use of trichrome stain. Tissue from the following organs are best stained with silver stain, except, so for us to look for the answer where we can state that this is the answer, so for us to pick up the best answer, we need to look at the components of, or the organ or the tissues that have what? The lymph nodes. And we can also talk about the tissues that have what? Reticular fibers, because when you talk of silver stain, it has to stain the reticular fibers. So if you look at the liver, the liver has the reticular fibers. Spleen normally has the lymph nodes, so meaning you need to expect it to have or to be stained by the silver stain. The brain, due to the presence of the nerve fibers, it can be stained by the silver stain. And then the answer here is just the thymus. The reason why it's the thymus, because you find that the thymus doesn't even have the lymph nodes. In comparison, the following organ has cells with the least number of smooth endoplasmic reticulum. So we have the ovaries, the testes, the adrenal glands. So the answer here is just the spinal cord. The following is the ascending order of tissue preparation steps in histology. So if you look at this question we did it in part 3 of our revision. So we have A, fixation, dehydration, clearing and embedding. B, we have dehydration, fixation, clearing and embedding. C, we have fixation, clearing, dehydration and trimming. D, we have dehydration, clearing, fixation, and trimming. So the answer here is just A. Regarding the microscope, A, both fluorescent and pyrolysis microscope use a dark background. So without wasting much of our time, I'll get A as our answer because it's the one which is correct. About the resolving power of microscope, A, cell membrane can be distinguished with a light microscope. B, resolving power of light microscope is above 0.2 millimeters. C, for electron microscope can allow magnification of up to 4 million times. D, ribosome cannot be seen under the light microscope. So the answer here is just D. Which of the following structure give the nucleus its structural support framework? Which of the following structures give the nucleus its structural support framework? So 1A, we have the lamins. B, we have the microfilament. C, we have actins. D, we have keratin. So the answer is just the lamins. Overstimulation of osteoclastic activity so can just lead to the what? Osteogenesis imperfecta. Which of the following cells contain gliofilament and glycogen granules? So in short here we are just talking about the presence of myelin. So we can just simply pick oligodendrocytes. A 5-year-old boy has severed his radial nerve. Which of the following cells play a major role in axonal regrowth? A, we have the fibrous astrocyte. B, we have the fibroblast. C, we have the protoplasmic astrocyte. D, we have the Schwann cells. So the answer here is just the fibroblast. All of the following statements concerning neurons are correct except A, we have they are of neuroectodermal origin, which is correct. They have not lost the capacity to undergo cell division. So the answer is just B, because you need to understand that the neurons normally lose their capacity to undergo cell division. Choose the correct statement concerning myelin. A, we have myelin decrease the velocity of an action potential, which is correct. B, myelin cells of the PNS myelin only one internode. So from our revision part, should be part 2, we did this question and the answer is just simply B. Let's move on and look at the next question. Tanycytes are a variety of dash cells in the walls of the third ventricle. So the answer is just the epidermal cells. Let's quickly move on and look at the next question. So the next question is, which statement is false concerning the Golgi apparatus? Which statement is false concerning the Golgi apparatus? So the answer here is just C, which is the cis face is away from the rough endoplasmic reticulum. Choose the correct statement about the cartridge. Choose the correct statement about the cartridge. So we have A, interstitial growth increase width of cartridge, which is wrong because interstitial growth it normally leads to the increase in terms of the length and not the width. Then we have type 1 collagen is most abundant in hyaline cartridge, which is wrong because we have type 2. Elastic cartridge appears glassy under the microscope. That one is also wrong because it's the hyaline cartridge which appears like that. So we just pick D as our answer because 80% is normally water and the rest is collagen. Regarding cartridge, the following statement is true. A, cartridge matrix has blood vessels, which is wrong because they are vesicular. Elastic cartridge has no pericardium, which is also wrong. The only one without the pericardium is the fibrocartridge. In its fresh state, elastic cartridge appears yellow, which is simply correct. Concerning the cartridge, which of the following is true? So A, we have hyaline cartridge is converted to bone by calcification, which is correct. because you need to understand that a baby has more hyaline cartridge as compared to the adult. As a result, that hyaline cartridge is normally converted to bone by calcification. In bone tissue matrix, vesicle containing the phosphatase are found in which type of cells? So A, we have the osteoblast, B, we have the osteoclast, C, we have the fibroblast, and D, we have the osteocyte. So the answer here is just the osteoblast. Regarding hyaline cartridge, the following is false. A, collagen fiber are more visible passing in between. So we need to understand that it is very hard for us to see the collagen fibers using a microscope. So the answer here is just A. The answer here is just A. The following is correctly matched. So A, articular cartridge, it has been matched with fibro cartridge, which is wrong. Menisc, it has been matched with fibro cartridge, which is correct. So the answer here is just correct. It's just B. Which is true concerning the Haversian system? So the answer is just A, which is it is not found in the sponge bone. Okay, we move on. Which of the following is correct about the basal body? Which of the following is correct about the basal body? A, they have no relation with centrioles. B, are located at the base of a cell. C, they have 9 peripheral microtube doublets. So that's the answer. True regarding blood cells. True regarding blood cells. A, half-life of neutrophil is 14 days. B, half-life of monocyte in tissue is 72 hours. C, reticulocyte have no nucleus, which is just the correct answer there. So you need to understand that the young red blood cells, which are known as the reticulocyte, they normally have no nucleus, and these guys, they normally also have the RNA. One of the following characteristics of muscle fiber is correctly matched. A, smooth muscle, cammodulin. B, cardiac muscle, satellite cell. So the answer here is just the cardiac muscle marked with the satellite cell. The following is true concerning the bone matrix. A, abundant type of collagen is type 2, which is wrong because it has type 1. In organic material represent about 80% of dry mass, which is wrong. Non-crystalline calcium phosphate is also present, which is also wrong. So no layer of fluid around calcium hydroxyapatite crystals, which is the correct answer. The following type of epithelium is linked to the correct example of a structure where it is found. A, simple cuboidal endothelium. B, stratified columnar, which is also endothelium. So endothelium normally have the squamous one. Then C, which is transitional minor calyces, which is just the correct answer in this case. Concerning human mitochondria, DNA is passed on from the spermatozoa, which is wrong. And then we have B, multiply by binary fission, which is just correct. True about cell surface specialization. A, microvilli have microtube, which is wrong. B, stereocilia have axoneme. C, cilia are only found in eukaryotic cell, which is correct. True about the anatomy of an axoneme. A, has no plasma membrane. B, dynein move toward the minus or end of the microtube, which is just the answer here. Let's move on and look at the next question. Okay, so guys, thank you very much for joining me. This was Dr. Possibility from Excel Academy. Please make sure that you subscribe to our YouTube channel.